My name is Paulette Ndjeunia-Mbiakop. I'm a PhD student in medical entomology at the University of Yaoundé 1 in Cameroon. Today, I will be sharing research on using a special biomarker to assess human exposure to Anopheles bite in a context of long-lasting insecticide net use in 2 rural localities of the East Region of Cameroon. The presentation will follow this plan. To introduce, malaria is a major public health problem in Cameroon, like in many countries around the world. In fact, Cameroon is among the top countries most affected by malaria, with more than 6 million cases reported in 2023. Surveillance of malaria transmission associated with vector control remains strategic for combating this disease. To achieve this, we have entomological surveillance tools to assess human Anopheles contact and the risk of malaria transmission. However, due to the limitation of these entomological surveillance tools, human antibody response to salivary peptide from Anopheles is increasingly used to measure direct human Anopheles contact. Indeed, when Anopheles bites you, it leaves behind a teeny bit of saliva, and our body reacts to this saliva by producing a special antibodies. The detection of these antibodies in the blood of the population reveals the level of that population exposure to Anopheles bite, evaluating the risk of malaria transmission in that population, and as well as the effectiveness of vector control strategies. However, the applicability of this technique to align the anthropological factor favoring human Anopheles contact that may be responsible for high malaria transmission in the East Region of Cameroon has not yet been evaluated. In our study, we aim to highlight the anthropological factor favoring human Anopheles contact using the G6P1 salivary peptide as a biomarker of exposure in 2 rural localities of the East Region of Cameroon. The study was carried out in Belabo and Wami during the rainy season when Anopheles are most active in the area. Wami is a small village who has grown since the Lampara dance was built in 2015 compared to Belabo, who there is a large town near a river. Concerning the methodology, a socio-demographic parameter and information regarding net were recorded using a questionnaire, and parameters such as age, gender, presence of vegetation were recorded. Malaria infection was determined using rapid diagnosis tests and stick blood microscopy, and the measurement of human antibodies level to Anopheles saliva was conducted in blood sample using ELISA method. The whole index of each net collected in the field was calculated using this formula, and the result was used to classify the net in different categories: good, acceptable, or damaged. Data processing was done using Excel software, and R software was used to generate the graph. As a result, a total of 78 people participate in the study, 51 in Belabo and 27 in Wami. Over 56% of the participants was male, age between 5 and 18 years. And around 51% of the participants had also vegetation around their houses, and 42% of population was positive for malaria. Around 85% of net collected in the field had at least one hold with a high percentage of damaged net in both sides. Participants from Belabo show a high antibodies level to Anopheles salivae compared to participants from Wami, suggesting they are more exposed to Anopheles bite. The same observation was made between male and female participants, and in the both sides, we know that males show a high antibody response to the Anopheles salivae compared to female participants. The presence of vegetation around household is a factor favoring human Anopheles contact. In our population, our study population, participants who had vegetation around their house show a high antibody response to Anopheles salivae compared to the other participants, the other group. The more you are biting by malaria vector, the greater your chances to contract the parasite responsible for malaria. In overall population, participants who was test positive for malaria show a high antibody response to Anopheles salivae than in the negative participant. Participants age over 15 and participants who had damaged net show a high antibody response to Anopheles salivae than the other group. To conclude, over 85% of net collect in the site had at least one hold with a high percentage of damaged net in the study area, and people levels of exposure to Anopheles bite varied according to gender, age, the presence of vegetation around household, and the patient stage 2, and the condition of the mosquito net. Parameters such as the presence of vegetation around household as well as the condition of mosquito net influence the level of exposure of mosquito bite and consequently the persistence of malaria. Thank you.